Depression is a life-threatening mood disorder manifesting as a combination of cognitive and physical symptoms that leads to a decreased interest in daily life, which imposes significant negative impact on people's quality of life and work performance due to disability, suffering, and a very high risk of self-harm. It's reported as the largest health concern in the 21st century. 1 million people commit suicide every year due to depression. Symptoms include feelings of guilt, sadness, worthlessness, desperation, the inability to experience pleasure, changes in appetite and sleep pattern, a lack of energy, poor concentration and memory, motor retardation, fatigue, and recurrent suicidal and death ideation, and these have to be experienced for more than 2 weeks. Now, as far as the diagnosis goes, it's carried out using validated tools, and one of the oldest and most widely used is the Hamilton Depression Rating Scale. It comprises both a clinical rated and a self-reported assessment. Another one is the Beck Depression Inventory. It uses a patient's self-reporting tool of their various depressive symptoms, and both of these are considered to be highly sensitive and specific, and therefore the best scales used for assessing the degree of severity of depressive symptoms. Nowadays, the first line of treatment is antidepressants, including monoamine oxidase inhibitors, tricyclic antidepressants, serotonin norepinephrine, and selective serotonin reuptake inhibitors, which you can read about here in the database. Despite the wide variety of antidepressants, a significant proportion of patients cannot reach full remission or they experience side effects. For instance, it's been reported that nearly 30% of the patients don't respond at all. And side effects include nausea, insomnia, agitation, weight gain, somnolence, sexual dysfunction, and cardiovascular adverse events have been reported. Plus, another downside of using them is the long treatment period needed to even begin to experience the beneficial antidepressant effect. Due to the ineffectiveness of treatment in some patients or the intolerability of side effects, a large number of patients just don't comply with the treatment and look for other therapeutic options. So, increasing number of people with depressive symptoms are exploring other non-pharmacological interventions, including psychotherapy and counseling, psychoeducation, exercise, problem-solving therapy, guided self-help, behavioral activation treatments, and complementary and alternative medicine. Complementary alternative medicine is defined as a broad set of healing resources, different medical products and practices for the prevention, diagnosis, and treatment of diseases, and it functions as a complement to mainstream medicine. In the United States, about 53% of patients with depression report using them. One of the options they choose is aromatherapy, so let's take a look at that and see how effective it is. In the database, look up depression, the main heading, and you'll find a link to this systematic review of aromatherapy. How effective is it? Now, a systematic review is where they take all of the qualified studies that they can find, put them together in a big pile, analyze them to determine whether they do indeed tell us anything significant about the use of whatever it is that they're reviewing. So here we see one on the effectiveness of aromatherapy for depressive symptoms. They reviewed randomized controlled trials of essential oils either used through inhalation or massage. The patients had been diagnosed using any one of several different diagnostic tools. So, what did they discover? If we jump down to their clinical recommendations, they suggest doing a pre-test when using inhalation therapy just to make sure that the patient's olfactory sense is working. And treatments in some of the studies were just too short. Positive results occur with longer exposure times and a higher number of sessions. At least 8 sessions are needed to treat depression. And when it comes to massage, they suggest that there be an aromatherapy massage treatment once or twice a week. Now on to their conclusions. There was a previous systematic review that concluded there was no sufficient evidence suggesting that aromatherapy could be used as a complementary and alternative medicine for depression. However, they show otherwise. Their review offers an overview of the most current evidence. Particularly, aromatherapy massage is shown to be more effective than inhalation aromatherapy to alleviate depressive symptoms. That's pretty cool. So let's take a look at some of the oils that have been shown effective in depression. Here's a screenshot of the section of the database devoted to those essential oils which have been shown to be effective for treating depression. As you can see, we've got bergamot, clary sage, frankincense, jasmine, lavender, lemon, manuka, rose geranium, rosemary, sandalwood, and ylang ylang. So if you click on any of these, they'll open up the information panel where you can find the studies, and they'll tell you more about how they work to relieve depression. Now let's turn our attention towards homeopathy. Does that really help with depression? By the way, if you're interested in homeopathy, we have a large section in the database devoted to it. So let's go back to homeopathy and depression and open the info panel. Here are some of the best homeopathic treatments for depression, but let's start with this PDF. This is a really good study looking at the effects of homeopathic medicines on reducing the symptoms. The differentiation feature between homeopathy and other medicines is following the holistic principles, focusing on the patient instead of the disease, considering a patient as a whole, eliminating the fundamental reasons of the diseases versus omitting symptoms, restoring health to all levels of body, and preserving it by enhancing defense mechanism. And the last, but not the least, using natural remedies which will not put harmful effects on the body. Obviously, make homeopathy more powerful than other routine therapies. I should add that this is the aim of all traditional forms of herbal medicine, and these days functional medicine as well. Now, the philosophy of homeopathy is to find out what is curable in disease. And the answer appears once the physician has knowledge about the real nature of the patient. And to reach that goal, all of the patient's symptoms at all levels of the human body should be taken. So, after that, the crucial reasons for the disease is revealed. Afterwards, removing the disease by restoring health, the very aim of homeopathy, will happen. According to the statistical findings, homeopathic remedies can reduce anxiety and depression symptoms dramatically. Many previous researchers have shown this effect and confirmed obtained results. So anyway, if you read through this PDF, you'll see how this study was conducted. It came up with positive effects, but I think one of the things that it's really emphasizing is that in order to get positive effects, you have to be dealing with a homeopathic physician who understands how to use this system. To give you an idea of how finely tuned homeopathic remedies are to the individual, let's just take a look at the notes section in the database in the homeopathy for depression section. So we see here, for example, Ignacia Amara. It says that it works very well for depression of a recent origin. The person needing it presents with extreme sadness and weeping. They also desire loneliness and avoid meeting people. They get absorbed in grief. Intense hopelessness also prevails. They get offended very easily and may have sudden mood fluctuations. Then to compare, we've got another one, Natrum Mur. It's indicated for treating chronic depression. It works wonders in helping a person to come out of a long-term chronic depression. The person requiring it constantly dwells on the past, unpleasant memories with intense sadness and crying spells. They bear their grief in loneliness. They isolate themselves and avoid going out. They're reserved personalities. They're prone to get irritated and get offended. And then we have another one, Aromatherapy, and this is for major depression with suicidal thoughts. So this is just an example of how you can't just grab any homeopathic remedy because you read that it's good for depression. They're very specific, and there's an important differential to pay attention to here. That's true for herbal medicine in general. When we turn towards the herbs that are used for depression, you'll see how they, too, are differentiated according to what's going on with a person, their constitution, their energetics, the type of depression, and so on. So we're not just going to grab anything willy-nilly. We're going to learn about what's going on with the individual at a deep level, and then we're going to also learn about our various natural remedies and how to use them. And towards that, in our next video, we're going to pay attention to the different types of depression, how they're defined, and different types of biochemistries that fall into these categories. So we're going to move to the types of depression, and that's going to help us in our journey towards identifying the kinds of treatments that may be best suited to you or your loved ones, if you're a clinician, to your patients. So stay tuned for the next video, and thanks for watching.